4 plus on Friday mornings. We have been getting updates on the COVID-19 pandemic situation in Imperial County. And today, well, we will be visiting with Imperial County Public Health Department Director Janette Angulo and Imperial County Chief Executive Officer Tony Rouhotas, and we'll be getting an update. Good morning, Janette. Good morning, Tony.
Good morning.
Good morning.
Okay. Now, this has been going on over a year now, and, which seems like forever, but, boy, are we seeing some good news, right?
We are. Earlier in the week, the state of California, because we met the 4 million mark of vaccination in the Healthy Places Index quartile 1, the county tier metrics, the thresholds, the parameters got adjusted. And because of that adjustment, Imperial County was able to meet the orange tier metric. So, we moved into orange this past Wednesday.
Okay. And of course, that means a little bit more of the economy can open up. Restaurants, for instance, can go to 50% indoor capacity. And, a few other very positive things. And trending, when we look at the numbers, and we do on a regular basis, unlike some states, we appear to be, we're getting a little bit of a surge, but we appear to be avoiding that big surge that some states are experiencing now, and that we experienced last June and July.
That is right, and I have the data right in front of me, and actually it's positive cases by collection date. That graph that you see when you access our COVID-19 dashboard, and you can clearly see the 2 main surges that we had in Imperial County, May, June, July, and then we had another one, October, November to mid-December. And you can see a little spike, starting mid-March, but it's not as big as the other 2. We are, keeping a close eye on that. We are asking our community to be vigilant, to don't let your guard down. We still need a mask, we still need a distance. The pandemic is not over. We do have vaccine, which is great. And not sure if you heard or saw that as of today, 16 and older, those that are they're needing a vaccine, they can seek a vaccine when wherever it's available. So, and that's in Imperial County. We decided to do that earlier than the state. The state is going to open it up mid-April, April 15th. But we decided to open it up now.
Okay. And the California website, myturn.com, you can go there. What we have suggested and what seems to work better is contact your physician, contact Clínicas de Salud, stay in touch with the county, contact local pharmacies, because the vaccines are being distributed on down the supply chain, right?
Yes, and that's very important that you mentioned the different places where vaccine is available. There's different programs. One of them is the state program, and those who are part of the state program, you'll find their information in MyTurn, myturn.ca.gov. Now, those that are receiving vaccine directly from the federal government, they will not be on MyTurn. And yes, the best is that you contact them directly. And those who are receiving currently vaccine from the federal government, it's many of our local chain pharmacies. So CVS, Walgreens, Rite Aid. We saw a few others now on the list. The best is to go to vaccinefinder.org, and you'll find a listing of all those pharmacies that may have vaccine in stock. Now, Clínicas de Salud is also receiving vaccine from a federal program, the Health Resources and Services Administration vaccine program. So, yes, contact them, visit their website, and try to get an appointment as soon as possible.
And many physicians' offices, healthcare providers are also getting vaccine. And so it is becoming more readily available than it was.
It is, and we have over 30 vaccine dispensing points in Imperial County. So yes, primary care providers, the hospitals, the pharmacies, our community clinic, check in with them.
Okay. And, it's one of those things. Imperial County seems to have been a little bit better prepared than the state or many other counties in the state of California. It's I think part of it is we're used to doing things. Okay, this needs to be done. Let's get it done.
That is right. When it comes to vaccine, we have a network of providers that on a yearly basis receive vaccine from the state programs. And so we are set up to be able to serve our community. I mean, we've done it in the past. For example, H1N1, we geared up when we received the vaccine and we were out in our community. And it was just not public health department. It was many of our partnering agencies. And the same thing is happening again. It's all of the enrolled vaccine providers who are out actively vaccinating our community. So I think we got it down, and it's really rewarding to see that other providers that had never done, for example, curbside clinics, drive-through clinics, they're now doing it as well, and that is great.
Okay. Now, you've been on the job officially for a little bit over a year. It's all got to be easy from this point on, right?
Oh, goodness, Carroll. As a director, yes, a little over a year. I took the position January 7th, but let me tell you, in the public health department, it'll be 18 years.
Okay.
So, yep.
Very good. Okay, Tony, wake up.
I'm awake, buddy.
Okay.
In fact, you said when we got to the orange tier, I think you're supposed to be buying Janette and I lunch.
I can do that, yes. And you pick the place, and I'll break the piggy bank so you can order whatever you want on your Big Mac, okay?
There you go.
Okay. Tony, moving forward in the orange tier offices with some restrictions able to open, how is the county gearing up to getting back to operations?
Yeah, great point. We actually had that conversation in a department head meeting this week. Departments are submitting their work plans just to ensure not just for the public, the safety of the employees. So that's being addressed. We have departments, of course, like the tax collector's office, the clerk recorder's office that need to make adjustments, and they're doing that. We recognize we got to get back to normalcy on the day-to-day operations of county workload. And for the public, there's some stuff that's been pending that needs to get caught back up. For the most part, the workflow for the county has continued. It's never stopped. However, the public interaction and the ability to be able to come in the county buildings is what we're addressing now. Of course, we still have to maintain safety measures in place. With the changes in the OSHA laws and the CDC guidelines, we need to still adhere to those. So we are making those changes, and the public will be notified here shortly of changes as they occur, and we'll keep everybody up to date.
Okay. For the most part, for the past year, the county able to operate with minimal disruptions, which is remarkable. Obviously, they're, with people not in their offices, I know there had to have been some issues, but for the most part, people able to conduct business with the county as needed.
Yeah, so it was definitely a huge change to implement telecommuting. I mean, if you're getting ready to do it, you do it globally with planning ahead, but usually you're not struck with a pandemic and then having to adjust based on that. However, I think we transitioned fairly well. I would say we had to obviously purchase a lot of laptops and create some remote access. but the ITS worked along with the departments. And I think really a lot of it goes back to the department heads being creative to be able to implement this. Being that you're usually, have all your staff in one location and having to swap to 50% here, 50% out in the rotation and everything. But really it's a testament to the department heads and the employees of the county to make this happen. It wasn't easy for everybody, and telecommuting at home is not easy for everybody, especially if you have children or other adults that are there on different shifts and you have to adjust to that. However, majority of everybody stepped up. We haven't really had an issue with it. And as you mentioned, we've fared pretty well on keeping the county moving forward. Okay.
What other things are going on in the county with the county that, moving forward, we should be aware of?
Well, I think the continuation of vaccine is the most important thing right now. Janette mentioned it earlier, 16 and older and get vaccine now. And I think Janette downplayed a little bit, but the coordination from her office, what's occurring right now with our partnering agencies is what's really moving us forward. Mentioned a little bit of a spike in positive cases over the last week. And there's a true balancing act that we need to ensure that we have, and the increase of vaccine and making sure that our public goes out and gets vaccinated. We waited for this point for so long that I think we really need to stress the importance of vaccine, and now making it open to a wider variety of patients being vaccinated is extremely important that we have that push. Janette mentioned our partnering agencies, and it's beautiful to see, you're working with Pioneers Hospital, Central Regional, the doctor's office, the clinics. I mean, Carroll, we've had meetings with the Farm Bureau, Veg Growers Association, CoLab, and really just spearheading this and getting the word out and creating clinics out remotely, Bard, Ocotillo, Sealy, Nyland, just getting it out there and making it happen. And you mentioned, Imperial County was doing this before the state did. And I think that's because of the collaboration we have, and everybody's somewhat a phone call away from, if you've lived in the Valley. And it's a true testament to how we do business here in Imperial County. And when we talk about partnerships, you and I having this conversation on Friday morning, the true partnership to getting that word out, but to actually have these vaccines out in the remote areas and being able to inoculate, our farm labor or our special groups. You can't do that in other counties, but we're able to do it. We've been able to do it forever. So I just want to say thank you to all the citizens within our community and all our partnering agencies, because truly we can't do it without them. But I can also stress the importance of asking everybody to go out and get vaccinated as soon as possible. We are nationwide. There is going to be a little bit of shortage on the Johnson & Johnson this week. I think we've seen the national news that 15 million doses were lost, which is going to interrupt the distribution supply this week. However, we're still getting a nice size allotment and pushing that out to our community and continuing the trend.
When I look at the dashboard right now, nearly 75,000 doses of the vaccine have been administered in Imperial County, and that is roughly 29,000 fully vaccinated. And that's a significant percentage of people, and that is just going to continue to grow. As Janette pointed out, and you said, the vaccines are now a little bit more available, and you're able to get them out and in people's arms. And of course, it'll never reach 100% because there are always those doubters that, you're going to give me a shot and you're going to be able to control my mind type. But those numbers daily keep growing.
Yeah, and then, I think we all know the nationwide numbers. They say anywhere from 60 to 70% of people want the vaccine. So that leaves us to the 30 to 40% of people that just aren't going to do it. You can't force them. You can only have to respect that moving forward. However, if we educate them and show them the positive side of it, the pros versus the cons, that's all we can do is just try to educate and see if, ask them to do their part.
And I just want to add that in Imperial County, with all other vaccines, it's a county that truly seeks, vaccination. And this hasn't been the exception with the COVID-19 vaccine. Our clinics fill up really quickly. I do want to make a quick comment about eligibility for 16 and 17-year-olds and the type of vaccine that they should be getting, and it's Pfizer. 16 and 17-year-olds wouldn't be eligible for the Johnson & Johnson or Moderna. So if there's a parent, if there's a legal guardian looking for a vaccine for their 16 or 17-year-old, it's the Pfizer vaccine. Ask for Pfizer.
Okay. And that is 2 doses, about 3 weeks between the first and the second. And are you aware of COVID arm?
Of COVID arm?
COVID arm.
Are you talking about the numbness?
Well, it is on the CDC website, COVID arm. Sometimes about a week after the injection, you'll get a little bit of a rash and a little bit of a soreness. And they have documented it. Okay, it's COVID arm. No big deal. It's the vaccine working.
Yeah, it was documented the other day. It showed some pictures of what the rash looked like and said it was somewhat normal to experience the rash and the numbness to the arm.
Yep. But they gave it a name, COVID arm.
Yep.
And it is nothing to be concerned about. And also, some people experience some lethargy and a little bit of achiness the day after, particularly the second injection. And again, that's the vaccine working.
Yeah, so it's interesting hearing people's stories because some people experience no symptoms at all. And some people, like you said, have lethargy and maybe a headache or some kind of mild symptoms for the following day or two. Some people say it's based on the vaccine that you get. And basically, I think it's really how everybody's body reacts differently to the type of vaccine that they're receiving. It's interesting hearing the different stories.
Yes. And whatever those minor reactions are, far better than coming down with the virus.
I think that's the best way of looking at it.
Right. And one of the other things that we have been tracking, hospitalizations have just dropped pretty much off the wall.
That's probably one of the best stats that we can use because for months and within multiple times occurring over the last year, our hospitals have been inundated and really taken a toll on our first responders and our healthcare workers at the hospital site. Knowing that number is down, and I think it was Luke Kinney from El Centro Regional yesterday that mentioned their hospitalizations of COVID patients right now are extremely low. And the better stat was the ICU bed availability and the amount of people, very minimal, on ventilators. So I also think that's a true testament to the vaccine as well, minimizing the hospitalizations. Because when they talk about efficacy in the vaccine, one of the biggest things was keeping people out of the hospital. And I think that's a big part of what we need to do to maintain stability within our county.
Okay. We're not over the hill yet, but we're on the top of the hill, and we can see where it's heading, right?
I think Janette and I both feel like we're over the hill already.
You, I would believe, not Janette.
Well, Janette said it best the other day. She said she feels like, we were talking about it, that we feel like we've been aging in dog years this last year.
Yes.
I'm ready to retire.
Okay. Very good.
And you know what? It is important. We go back to what the chief said, and it's related to being vigilant and still wearing a face mask, staying 6 feet away from others, avoiding the crowds, avoiding poorly ventilated indoor areas, washing your hands, all those things that we've been, saying, sharing with our community, continue doing that. And not only that, now that a COVID-19 vaccine is available, get it. It's safe, it's effective, and the sooner we have our entire community vaccinated, the sooner we go back to our regular, normal.
I don't think I've been normal in years, but, we're looking forward to, seeing people that I haven't seen in a year.
I think that's the biggest thing. And since you brought that up.
What, the fact that I haven't been normal or that I can see people?
Well, I was going to be nice. But, the interaction with people and there's a big change for schools. You're starting to see school activity now as well. So to get our kids back to normalcy, somewhat back in school, being active and being able to have that socialization, I think is extremely important. So knowing that the schools are making strides to make things happen in the community as well, I think is really important overall. Not just for the kids, but the family in general.
You've got it. The mental health issue that goes along with it will be improving significantly as well. Janette, I appreciate the visit. Janette Angulo, the director of the Imperial County Public Health Department. Tony, the Imperial County Chief Executive Officer, Tony Rouhotas. We appreciate the visit today. And nothing personal, but we're hoping within about another 6-8 weeks, maybe we won't be doing this.
That is correct. That is correct. And that was part of an announcement that the governor made earlier in the week, and it's called Beyond the Blueprint. And if all goes well, then we should be moving away from tiers and colors, or the Skittles, like you call it. So looking forward to that day.
Well, for Easter, it was the jelly bean scale.
But Carroll, you can still call us on Friday.
Okay.
All right.
We appreciate the visit. Have a safe weekend.
You too. Thank you.
Take care.
The Imperial Valley's best oldies on the radio.
You bet.
Imperial County Air Pollution Control District provides you with air quality reports daily. How is your air quality today? Check current air quality conditions in Imperial County at imperialvalleyair.org. You can sign up for free air quality alerts to be delivered directly to your email address, or you can download the Air Quality Alert app to your mobile device today. Stay informed with Imperial County Air Pollution Control District.